Hey, this is Arushi, and welcome to Healthcare on a Budget, a show that empowers you with info for navigating the healthcare system more smoothly and save some money.
Welcome back, everyone. This is your host Arushi. Thank you for showing support to my first video. Keep showing the love and subscribe to my channel. And before we move on to today's episode, I wanted to re-emphasize that this channel is for anyone and everyone who wants to understand how to navigate the healthcare system to stay healthy in a pocket-friendly manner. Since the last episode, did you try booking an appointment with your primary care and couldn't find a sooner date? Or you are the one whose calls to the clinic have gone unanswered? Well, then today's episode is just for you, where we'll talk about why doctors are not available and how to slash wait time in primary care. For us to better understand the reasons of primary care delay, we need to go back in time and contrast the role of a primary care physician then versus now.
You're going to become their doctor, who understands them and whom they want to see and nobody else.
What you heard in that last clip is that in mid-20th century, primary care physicians were allowed to have enough time per patient visit to look through their medical history, even family history, and get a full scope of patients' health. Amongst other changes in the healthcare system, the shift in the role of primary care doctor from the doctor to an entryway for patients to see specialists have increased burden of administrative tasks for such doctors. As a result of that, the window of time you see your doctor for is shrinking day by day. Then there is a steep shortage of primary care physicians due to doctors leaving practice because of retirement or burnout, and fewer medical graduates entering the field of internal medicine. We can have shortage of about 48,000 PCPs by 2034 per Association of American Medical Colleges. Even the healthcare payment model is unsupportive of team-based primary care, with a shift from fee-for-service or volume-based payment to doctors to a more quality of care for population health or value-based system. There is a de-emphasis on individualized disease management by PCPs. This coincides with the fact that US has the lowest primary care spending against total health expenses compared to other developed market-based economies. Delay at the physician end is only half of the issue. There are roadblocks or access barriers that quite a few people face in trying to get appropriate primary care. One of them is limitations placed by state practice laws that can prevent patients from seeing nurse practitioners when physician is not available. Jump in out-of-pocket cost of as little as $10 can also deter patients from visiting primary care clinics. Patients could also feel their pockets squeezed due to consolidation happening across primary care markets by corporate giants buying small practices. Plus, delay in seeing their PCPs is forcing patients to redirect their care to urgent care centers and retail clinics. Additionally, it is worth noting that some insurers can have a restrictive or fail-first policy that can prevent or delay appropriate care to patients. I know, I have talked enough about the problem. Let's look at some ways to get around it though. Number 1 is to go for a team-based practice. Health medical groups or clinically integrated network, patient-centered medical homes, or even independent physician associations focused on high-quality care are all the versions of team-based practice where you will get a continuum of care from different providers, like nurse practitioners, PAs, and physicians. Is a membership-based primary care model called concierge or direct primary care, where you pay annual or even monthly fee on top of your insurance premium to access primary care practices where doctors have a smaller group of patients and can thus dedicate adequate time per patient. This is also called at your service care with paid membership. Number 3 is to go to retail clinic or urgent care, but for less complex illnesses. Retail clinics are clinic within a store model where you can go for vaccines, sore throat, flu, or even physical exams. Urgent care are for more acute but non-life-threatening illnesses. Make sure though to update your PCP about these visits each time. The fourth way to minimize primary care delay is to have your health record accessible. In a digital or a paper-based format, it helps you to keep your health record and updates in one place and communicate them to your PCP. You can do so by using apps like Apple Health, One Record, etc., where you can even manage records from multiple different providers. And last but not the least, if you can, then plan your PCP visits ahead of time. Before ending this episode today, I would like to thank Dr. Sandeep Prabhu for his expert insights that helped make this video possible. That's all for today, folks. Do remember to share your thoughts and feedback in the comment section below. Next time, I'll have Dr. Jeffrey Milstein from UPenn sum up this primary care series on the channel and share his thoughts on how can we make the most of it. So stay tuned and take care.